Prostate cancer research is evolving quickly, like so many other cancers, and it's important for patients to stay up to date on developing news. So, are there research advances that patients should be aware of?
Yeah, I mean, I think some of the treatments that I just mentioned, PARP inhibitors, pembrolizumab for MSI high or mismatch repair deficient tumors, and lutetium, those have come out of recent major clinical trials and have become the standard of care in a lot of different, in various different settings for patients. And there are always, new research trials, clinical trials that are going to, either move some of these established treatments to earlier lines of settings, earlier lines of treatment, or using them maybe in combination with other drugs, where we might learn that they're more useful if we combine it with, another drug, or maybe combine it with hormone treatments earlier rather than later. So there are always clinical trials for advanced prostate cancer. There are even newer trials of novel therapies, completely new treatments that have been studied in a laboratory and say, petri dish models of cancer or animal mouse models of prostate cancer, but have shown enough early exciting data to try to move them into human beings and hopefully help advanced prostate cancer patients.
As we wrap up, Dr. Gao, I'd like to get your thoughts. How do you feel about where we stand with advanced prostate cancer care?
Yeah, I think there have been a lot of advances in advanced prostate cancer care in recent years. Newer and better treatment strategies seem to come along actually every couple of years. And I think what we've seen for advanced prostate cancer patients over the past, really since probably 2015 or so, is a significant improvement in outcomes, long-term outcomes like survival and slowing down of the cancer. And I think it's important to acknowledge that, and to acknowledge that the clinical trials in recent years have really led to a lot of improvements, and really the hope that in the coming years there's going to be additional research, additional clinical trials, newer treatments, hopefully, that will continue to improve outcomes for advanced prostate cancer patients. I also think that it's really critical to evaluate the specific patient's cancer characteristics, things like the genetic testing that I mentioned earlier, as well as their sort of life situations or other medical comorbidities, to come to a shared decision about what makes the most sense in terms of their cancer management. Genetic testing, might open up the option for certain FDA-approved therapies, or consideration of certain targeted therapies that might still be in clinical trials. And clinical trials, again, are also an option for some patients, really to provide access to newer treatments or additional treatment strategies that otherwise would not be available.